I'll now perform a physical exam on the 20-year-old female from the PES today. I would first have the patient, or I would first ask the patient's general appearance, and then I would also get the patient's vital signs. I would then ask the patient to lie down. I would have the patient get proper exposure by asking the patient to lift their shirt. I would then inspect the abdomen, noting any masses or lesions or ecchymosis. I would then light auscultate the abdomen in all 4 quadrants, and I don't have my stethoscope. Go there, in there, in there. Noting any bowel sounds or abnormal bowel sounds. I would then perform light palpation on all 4 quadrants of the abdomen, watching the patient's face, noting any grimace to the pressure. I would then perform deep palpation with one hand over the other, feeling with my bottom hand and pressing with my top hand. I would then percuss in all 4 quadrants, noting any dullness or hyperresonance to percussion. I would then have the patient sit up so I can perform the heart and lung exam. I would check the patient's pulse. Checking for a regular rate and rhythm. I would have the patient lie back down and listen to the heart with my stethoscope, which I do not have. I would first auscultate the carotids for bruits. I'd have the patient turn their head to the left, and I'd auscultate for bruits on the left. Ooh, you can't see me. Okay, I'd auscultate for bruits on the left. I would then auscultate the heart in the aortic area, the second intercostal space, right sternal border, pulmonic, second intercostal space, left sternal border, tricuspid, fourth intercostal space, left sternal border, and then the mitral area, fifth intercostal space, and the clavicular line. Then I would perform the lung exam. I'd have the patient stand up, or sit up, sorry. I would use my stethoscope to listen to the front and back of the lungs. Go here, 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 and here. And then for these purposes, I'm going to have the patient kneel and face the wall, so I can show where I would auscultate on the back. I'd have the patient take a deep breath in and out of an open mouth. Try not to make any noise when they breathe with their hands on their hips. And I'd go here. And then along the sides of the lungs. Okay. Now I'd have the patient sit back down. And I would note for equal rise and fall of the chest for symmetrical breathing. I would then perform, that's it. I already said pelvic exam. I would then perform a pelvic exam on the patient. I would ask the patient to get proper exposure and lie down on the exam table, which I'm not going to do. I would first inspect the external genitalia, noting any abnormalities. I would then palpate the external genitalia. I would then perform the speculum exam, noting for any discharge or abnormalities in the vagina in the external os. I would then perform a bimanual exam, noting any cervical motion tenderness or adnexal masses.